Canada, the U.S. and Mexico are taking a united stand on Ebola to try and stop the virus spreading from Africa to this continent during the upcoming FIFA World Cup. Today, the three countries announced they've aligned their public health measures relating to travelers. And the CBC's Hilary Johnstone is following this part of the story and joins me in the studio. And Hilary, we heard from the federal health minister last hour. What did she have to say about these measures? Essentially, they're not perfect, but they're something.
There's something, and she says that part of the reason they're doing this, of course, is because, yes, there are going to be people coming here, even if some of these teams from the Central African countries aren't necessarily going to be playing here in Canada. Still a recognition that there may be an increased risk when you have people that are all coming here all at once. All of this press conference from the minister, that came after a trilateral statement that came out earlier today from Canada, the U.S. and Mexico. It said this, saying that these three countries have announced aligned public health travel measures for individuals coming from African regions at greatest risk from the Ebola virus. They went on to say that this coordinated approach aims to protect our citizens and millions of visitors, fans and athletes and tourists during the World Cup. Now, it was a little bit unclear to us at first if that meant that there were new measures being announced today. It would seem that there are not necessarily, but we did hear from Canada's health minister. She was asked very specifically by a reporter whether or not the United States had put any sort of pressure on Canada to up what Canada was going to be doing in response to some of these Ebola concerns, especially with the World Cup about to start, or FIFA World Cup about to start. So here's a little bit of what we heard from Canada's health minister.
Was the U.S. pressuring Canada to move on this?
No. Nobody was pressuring Canada.
The U.S. administration didn't talk to you at all about travel measures?
No, I spoke directly with my Mexican counterpart and we had a discussion and we were saying we need to align. You need to understand that Canada don't have match in Canada with the Congolese. You know, the Congolese team is not coming here because they are playing in Mexico and the U.S. But we are partnering in this. We are in the same region and it's, but we didn't put exactly the same measures, but we are aligning our measures.
So that would seem to be the answer to whether or not there's anything new being announced today, that they're not exactly the same measures across these three countries, but they are trying to be aligned. So what is in place? Let's take a look at these three countries, starting with Canada. We know, for example, that Canada has banned, although that's not the language they're using, they're talking about a temporary suspension of visa application residents that are coming from the DRC, Uganda, and South Sudan from entering for 90 days. This is as of yesterday. It goes until the end of August. We know that Canadian citizens and residents, permanent residents coming from these affected areas will need to quarantine, self-isolate for some 21 days. They will be provided with a location if they don't have that. There will also be tighter screening at airports. The United States, for its part, has now banned non-citizens from traveling from the DRC, Uganda, or South Sudan. They have now also extended that to green card holders who have been in the country for some 21 days. Mexico, for its part, it has tightened airport measures. They're also urging their citizens not to travel to the Democratic Republic of Congo and are also asking that anyone who is coming from there to observe this 21-day quarantine period.
And we're getting reaction from the World Health Organization regarding the North American measures. What's it saying?
That's right. They're saying that based on what they know at this point, that they don't feel like travel restrictions are the best way to go. Instead, they would like to see more screening at airports. So here's a little bit of what the World Health Organization has said today. They say that based on their current assessments, that yes, they think that the risk in these regions is high, but globally the risk is low. So they say based on available information for the current outbreak, WHO advises against any restrictions on travel and or trade to DRC or Uganda. Instead, they say that they are asking countries to do more cross-border screening and screening at points of exit, such as airports. That's what they feel should be done.
Hilary, thank you. CBC's Hilary Johnstone.